There's one essential step in clinical examination when you're examining the child, which if you miss, you can be sure that it will be very difficult to pass the exam. What is that single most important step? So, for example, you're examining the abdomen of a child, and you obviously explain to the child what you're doing, explain to the parent. And when you're examining the abdomen, you should not only look at the abdomen, but you should be looking at the child's expression as well. Because very often it might happen if any part of the abdomen is tender and the child is wincing in pain and you're not seeing his expression. Because sometimes he might be quiet and wincing in pain and he might be tears rolling down the eyes and you're not looking at his expression or checking after every few seconds that is that okay? I hope I'm not hurting you. Are you okay? Are you comfortable? While you're moving your hands over the abdomen. That would reassure the parent and the examiners that you're concerned whether your child is being hurt or not. Same for looking at the limbs. When you're suppose examining a swollen limb or a knee joint, when you're seeing the flexion and extension of the joint, you should be looking at rechecking again and again the expression of the face of the child. Is the child or the teenager in pain or discomfort? So when you're moving the joint, always ask the teenager, do it very gently and say that I'm examining your joint, do let me know if it's painful, and just check when you're flexing or extending the joint that is it painful, and if he's wincing in pain or he says so, you say sorry and you stop doing it. This is a simple point and very humane point which very often I've seen candidates missing, ignoring the expression of the face totally, and that can cause failure. So avoid that. Be more humane. Keep checking the child's expression and keep asking if the child is comfortable while you're examining. Thank you.